Good morning, I'm Kyla Grogan, and we are going to go behind the scenes today of a cosmetic surgery procedure. I am here with our willing patient and subject, Barbara Hawkins. Good morning.
Good morning.
All right, Barbara, are you excited?
Yes, very excited.
Tell me what you're feeling right now.
I'm a little anxious, but I am just ready to run. I want to do this. I'm excited. I know what the end results are going to be. I'm a medical esthetician. I've seen the doctor's work. I see pre and post, and I feel like the shoemaker's daughter. It's my time. So I want to go and do this.
Okay.
You see you have a little bit of hyperpigmentation, sun damage. You have some broken capillaries. I tell all of my clients, I say, look in the mirror and see what your concerns are. Everyone sees each other differently, and what you might think is a problem, I might not think is a problem. As an esthetician, I know the skin and I see things. I see with my own face the aging, the lines here, my larger pores, the fine lines and wrinkles. So I know that with the lift, it's going to take and clean up all this. The fractional laser is going to resurface. It's going to help my skin be the best. And over time, the collagen is going to rebuild. The cells are going to be tighter. I'm going to have a more reinforced structure so that my skin looks better. It'll be more supple, more dewy, more relaxed. That's what I'm looking for. Any questions or concerns, please feel free to give the office a call. Okay? You have a great weekend. Thank you. Bye-bye. To go back on things, I'd like to talk about everyday life. You know, I'm a medical esthetician and I work full-time. I'm a mother of 2 teenagers. My daughter is 17 and will be going to college in September, so that's a hectic time. I have a 15-year-old son who's feeling his oats, which all teenagers do. But I'm a single parent, so I'm going through a divorce right now, which is never pleasant. No matter what anyone says, it is not a pleasant situation. So that adds stress. Paying the bills, taking care of 2 kids, being a single parent, and working full time adds a lot. Unless I own my home, I have to take care of that. And now, on a lighter note, I'm out dating. So there is a gentleman that I'm seeing, and things are progressing along. It seems very nice. He knows what I do and who I work for. But again, doesn't think anything. And I have not told him about what I'm doing tomorrow. I briefly said something that I'm having like a chemical process. I wasn't going to go into detail about the facelift and the CO2 fractional laser. All I did say to him was, I'm not going to see you this weekend. I have some things to do at the office, so the weekend's out. But it's a good thing, because I know I'm going to heal that fast. The next weekend, we will see each other. And it'll be a revived, regenerated, a better me.
Barbara is this incredible, high-energy, enthusiastic, and passionate esthetician who works in our spa in Garden City. She also comes out to Manhattan as well. Barbara has been talking to me about doing something to make her look better. She has been taking care of many of my patients after surgery. After they have their facelift, she's been doing a wonderful job with skincare, and so she's seen firsthand my approach to facelifting surgery.
Dr. Prasad is world renowned for his eyes and his facelifts. Doctors come from all over the world to watch him. So why wouldn't I put my face in his hands? So that was an easy choice.
I like that saying that you're putting your face in his hands, because you really are.
Yeah.
So now I'm having a moment. I guess I worry about my children for this surgery. I know this is normal. I just get crazy like this. But I have 2 kids. I want to make sure that everything's okay with me afterwards. It's a local anesthesia. I'm not supposed to get crazy. I'm not going down. This is twilight. So it's really very simple. But I worry about the wood floors if you don't wipe your feet. So this is just my nature. Okay, the cameras are rolling, so I have to go and talk. Okay? Okay. I'll talk to you. Bye-bye. Okay.
All right. So the night before surgery, patients are usually very anxious.
I was really anxious. I couldn't wait for midnight. I went into bed.
And that is the worst part of the whole surgery is waiting to have it done. We tell them to try and get a good night's sleep, which is impossible. But
I fell asleep right away, so that wasn't a problem. I guess I got up around 5:30.
But eat light the night before. Again, no aspirin, no Aleve, no Advil.
And I spoke with you about the larger pores and the wrinkling here, the creeping of the skin, my fine lines and wrinkles around my lips and my chin. My main concern, though, and I'm sure we can see this, is that jowling effect and how gravity has pulled these things down, and I have that little dent.
When I looked at her, I saw that she has a little bit of jowling and looseness of the skin around the jawline and some looseness in the neck. So I recommended that we do a face and neck lift at the time whenever she'd like to.
So before I get that protruding rich chin, I want to make sure Dr. Prasad can pull everything back and tuck it in. Maybe the best that I can.
So she's been very excited about doing this, and I'm looking forward to helping her.
Because I know it's going to be the best. The true thing will be March 24th, when I really reveal myself to a lot of people at our event. So with that being said, I'm going to say goodbye until after the surgery. And just another thing, I'm very relaxed, because they did give me a little bit of a, to cut the edge. And it's working. So I suggest that for everybody. All right, I'll talk to you guys later. Bye.
Close your eyes. Bring your chin down a little bit. Good. Relax your face as much as you can. Just close your eyes again. Good. Just good. Your chin down. Good. Open your eyes. Now let's turn your face a little bit.
Okay, we're right outside the operating room here, and I've caught up with Dr. Amir Prasad. Dr. Prasad, thanks for taking some time to talk to us.
Thank you.
I know you're a busy man.
Sure.
Now, he is what's known as a super specialist oculofacial cosmetic surgeon. Tell me what that means and why you're a super specialist.
Well, if you think of the field of medicine, how many advances have occurred over the last 20, 30 years, it's comparing, let's say, a family practitioner to a cardiologist.
Okay.
So within the field of plastic surgery, there is a need for people to super specialize. So my background training is in ophthalmology, then plastic surgery of the eyes and the face. So I'm a super specialist. I specialize in cosmetic surgery of the eyes and face.
Okay, so someone like Barbara today, she is really putting her face in your hands.
That's right. That's right. She is somebody who works with us and has helped me in taking care of my patients after surgery, and so she knows my work. And the idea is to do something that looks very natural and with a quick recovery.
Okay, and that gives us a segue into what I want to talk about, which is tell us your philosophy, because really it is a philosophy of surgery that you practice.
Well, there has been a real shift. When I went into practice, my core group of patients were baby boomers. And the thing about baby boomers is they don't want to look unnatural. They want to look like themselves. So my core philosophy is everyone's face has character, and we want to retain that character. So we don't want them to look plastic. So the idea is to restore, not to change. So give people back their jawline. Give them back their natural, bright-looking eyes.
So kind of maybe get a version of you that might be a little bit more refined you, but yet you're still in there.
Right. What I tell people is essentially we're moving the clock back several years, somewhere between 5 to 10 years, but you look like yourself. So people who know you won't know why you look so much better, but you just look natural.
Okay, it's kind of like a great haircut then, I think. When you get a great
Right.
haircut and people are like, I don't know what you did, but God, you look really great.
That's the most common thing people say, is that when they can't tell why someone looks better and they think they changed their hairstyle.
Well, and you also consider yourself a bit of an artist. I mean, you're using surgery, but kind of in an artistic way. Explain that a little bit.
To me, it goes hand in hand. To do a field like cosmetic surgery, you have to have an aesthetic vision. And that's something you can't teach. It's something that you have intrinsically. Since I was a child, I drew, and I was actually advised to go to art school. So I'm very fortunate and blessed to be able to do a specialty where I can do both, where I can use my talents as an artist to do the surgery, which requires technical skill.
Okay, and your latest masterpiece today is going to be Barbara.
Right.
So talk to us and tell our audience a little bit about what she's getting done today and what she's hoping to achieve with it.
Most of the area that needs attention is the lower part of the face. It's this part that has sagged and lost a little volume, and that the jawline is less defined. So I'm going to just make this a relatively short line, because this part doesn't need that much attention, but this part does. So this is to make sure that we don't get any folds up here. To find out where the jowl is, extra a little bit of fat, and then this area, which is referred to as it's called a mandibular notch. This marionette line. So everything. The goal is to bring everything up like this, but not to have her over pulled and look unnatural. So I give myself some guidelines so that during surgery, when she's laying down, everything, I have some marks to show me what everything looks like when someone is standing up.
So what I did was I employed a lot of advanced techniques of local anesthesia, lighter sedation, less trauma. It's kind of comparable to like people doing laparoscopic surgery.
Okay.
They're doing everything through smaller openings, and they're back to normal life quicker. So that's the main thing that we've been able to advance over the many years I've been in practice, over the past 15 years, so that people can go back to work in about a week.
So we're really talking, she's going to have this procedure done today, and within a week,
she'll be able to go back to work. And what's important to differentiate is it's not a shortcut. It's not a mini procedure. It's a proper procedure that will have the longevity of a standard facelifting procedure, not to be mistaken for any of the shortcuts. Because there's no point in doing a shortcut if you're not going to get the long-term benefit.
there's the result that you want.
Exactly.
Okay, now she's also having a second procedure done.
The second procedure is going to be a CO2 fractional laser.
Okay.
And that's going to resurface the top layer of my skin. So that will help with fine lines and wrinkles, my hyperpigmentation, and start to rebuild my collagen, which is deep in the dermal layer, so that it can reconnect my skin and make it tighter.
So it's kind of like you're getting the procedure done and then you're kind of buffing the car.
There you go. I'm waxing it.
That as well as new collagen. So when we get wrinkles, it's because we're losing collagen in our skin. And with this laser, we're able to stimulate collagen in a very, very measurable way. And it's really the icing of the cake, because now you've got this beautiful facelift and glowing skin to go with it.
Sounds good to me. Okay, well, we know you're very busy, and we appreciate you taking the time to talk to us, and we wish you a fantastic procedure. Thank you. Dr.
Thank you
Prasad.
very much.
So, Dr. Prasad, how did the procedure go?
The whole procedure went perfectly, and I'm anticipating that she's going to be very happy with the results.
Good morning. It's Friday, March 12th, 7 days post my surgery, with a quick facelift recovery. And I just want to let you know how I'm feeling and what I'm doing. The surgery went really well. I was very pleased with it. There were no complications whatsoever. Dr. Prasad did a great job. I also had, besides the quick facelift recovery, I had this CO2 fractional. So that is where the resurfacing of my skin is, as well as the removal of the excess skin and taking out the fat that's atrophied, and to strengthen my jawline to make it more prominent, because it had a couple dents in it. I did go through mild discomfort. Wasn't anything bad. I didn't need any painkillers at all. I slept with 2 pillows. Slept 6 and 7 hours. I think I drank more fluid, so I would get up just to go to the bathroom in the middle of the night. That was really it. It wasn't the pain woke me up. I was able to shower 36 hours later, wash my hair. I have sutures. I'm going to show you this now, because you'll see that this part of my skin has exfoliated, which it's supposed to. This part still hasn't. I'm keeping it moist, but I still have some discoloration here. There's the suture marks here. I have sutures here in my ear and then back in my hairline. But I was able to shower. Not a problem. I blow dry my hair. Today I have on very minimal makeup. I have on the Skin Survival Kit, which I have the vitamin C, the Intense Vitamin C Serum. I put on a little bit of the Eye Rescue. And today, even though it's overcast, there still is sun out. I wore my SPF 30 with a tint. That's all I have on. I have no blush, nothing else. I did put on a little bit of eyeliner and mascara, just so that I wouldn't be so scary for the camera. I really have no complaints. Everything looks great. I can see my skin is good. My pores are smaller already. A little bit swollen still. That's expected. I have a little bit of bruising. You can see on both sides. Sutures that haven't even been taken out yet. We're going to do that today.
We're going to be removing sutures today. It's 6 days, but she's healed nicely, so they're ready to come out. She kept the suture line nice and clean. She kept her hair out of it, and she's ready to have them taken out. This is usually the hardest one with a knot for, because then in front of the ear, they're running stitches, and they're easy.
I have no pain or discomfort at all right now.
Good. It's like Dr. Prasad sews beautifully. He really does. Okay, Barbara. All your stitches are out. Perfect. Let me put you back up. We're about to trace one on here for you. Wasn't too bad, was it? Not at all. Good.
I think the noise of the scissors biting
I know.
was more. Feel like painful at all? That's fine. And as I said, this is 7 days. I feel terrific. I didn't lose my appetite. I didn't lose sleep. I just know I found a new me. So that's what you have to look forward to. So I'm going to say goodbye and enjoy the rest of my day. Okay, see you in a few days. Good morning. It is April 30th, 2010. 55 days since my procedure. So everyone knows that I did have a quick recovery facelift as well as the fractionated CO2 laser. How I feel. I want to tell everyone I am elated. I cannot believe the transformation. I can't believe people didn't tell me before that I needed this. And the proof with that is my before and after pictures. So I'd like to share that with everyone because I was in shock. My before picture is my grandmother. Now that sounds a little harsh, but it was my grandmother. And now her granddaughter is sitting there. So when they say to project what your future would be like, I was the future and now I'm in the present. And that's because of everything that I went through with my procedure just 55 days ago. So are you ready? This is my before and my after. I was in shock. I think this says 3,000 words, not even 1,000 words. Before my surgery, the feelings that I had were, I was tired, I wasn't rested, I could start to see the fine lines in my face, my hyperpigmentation. I didn't look my best. You know, smoke and mirrors, you could change some things and wear some makeup and try to get your sleep and drink plenty of water, but I was beyond that. So I think that now my skin looks its best. I am more relaxed and using less products and less time to achieve my goal. What's better, coupons to go shopping with or a great facelift? I don't know. Let's go find out. It's going to fix me up. Not a blind date, but it'll be fun. I want to get a great outfit to match my great face.
I'm ready. I have a new face, new dress, new shoes. Now let's have lunch.